November is Lung Cancer Awareness Month, and I'm Dr. Henderson at Coastal Cancer Center, and we can talk about a few warning signs for lung cancer. You want to look out for persistent coughing, and that would be coughing that lasts for 3 weeks or longer, or if you have a chronic cough that seems to be getting worse. You also want to look at changes in the type of production you're having from your cough, or if you're having any coughing up of blood. Now, these signs by themselves necessarily don't mean you have lung cancer, but they are going to be things that you're going to want to have checked out by your family doctor first. And typically they start with getting a chest x-ray or a CAT scan. Other things you want to look out for are worsening shortness of breath or pain when you take a deep breath in. So also to go along with that, I can talk about some of the latest advancements in lung cancer treatments. And a lot has changed over the last few years. Really, treatment is geared towards being as tolerable as possible as far as side effects go, also being more effective than treatments that we've used in the past. And while chemotherapy is still used very frequently in lung cancer, it's typically used as an adjunct with other treatments, surgery, radiation, or immunotherapy, and now even new targeted therapies. Surgery is typically reserved for early stage lung cancers, stage 1 and 2, occasionally stage 3. And stage 3 lung cancers are doing much better within the last 5 years with the introduction of immunotherapy into the space of stage 3 lung cancers. These patients are doing much better than they did before these immunotherapies were approved. For stage 4 lung cancers, we're often using now targeted therapies. And the way this works is when you are diagnosed with a stage 4 lung cancer, your doctor will send off your biopsy and they look at the DNA of the tumor. And we now know of certain driver mutations for these cancers, or mutations that are actually causing you to have the cancer. We've now developed medications that specifically target these mutations you may have. These mutations are still fairly rare. About 1 in 5 patients will have a driver mutation that can be targeted with a pill, but also we look at patients who would be more responsive to immunotherapies. So again, treatment is being geared towards making it more tolerable for the patient, but also more successful than just chemotherapy by itself.